Hello friends, welcome to my new video. So today in this video, I'm going to discuss with you all about keratoconus. Okay, so let's start. You can see in this picture that this is the normal cornea, okay, normal eye. And here, if you compare this picture with this picture, then here you can see the cornea is looking normal. Here curvature is also looking normal, but in this the second picture here, it is not looking normal at all, and the curvature is also not in uniform, like not like a normal cornea. So this is keratoconus that we are going to discuss now. Okay, so keratoconus is a genetic inheritance condition where stromal layer of the cornea is become weaker progressively, which slowly leads to cone shape of the cornea. So it means that cornea is not that much strong in keratoconus, so that the corneal shape is cannot be retained, and it get deshapen with gradual time. Okay, so that is keratoconus. Now, what are the causes of keratoconus? First of all, frequent eye rubbing. So, suppose a person is having any infection to his eyes, like blepharitis, or due to any swelling or like chalazion. If he rub his eyes so much, okay, so this rubbing leads to injury to the cornea also, so that the fibers of the cornea get weakened, so the corneal shape is misshapen. Okay. Now, another cause is that congenital due to heredity. Okay, so what is congenital? That means if the keratoconus is present from by birth, that means if there is a hereditary condition of keratoconus, then also the person can have keratoconus. Marfan syndrome. So this Marfan syndrome is a connective tissue disorder where the connective tissue of the body get weakened. Okay, so in Marfan syndrome also the fibers of the cornea is weakened, so it ultimately leading to keratoconus. Now Down syndrome also, Down syndrome, that is also known as 21 chromosome disorder, where there is a mispairing of the chromosome in that particular number, so which lead to several abnormalities in the body. So it can also lead to keratoconus. Now, what are the symptoms? So if the person is having keratoconus, then the symptoms will be blurring of vision, distorted vision, mean object appear in a bending manner, sensitivity to light, and frequent changing in glasses, because the cornea is gradually misshapen. So it ultimately lead to frequent change in glasses also. So keratoconus has been seen a bit more commonly in males than in females. Okay. So now you can see in this picture. So here the cornea is cone shape. It is keratoconus. This is due to keratoconus because the fibers are affected. There is stromal fibers. So these are the first sign of keratoconus. So first sign is Rizzuti sign. So Rizzuti sign. So these are conical reflection on the nasal cornea. Okay, when a pen light is shown from the temporal side. So this is the Rizzuti sign. Here you can see a conical reflection here like this. So torchlight is from this temporal side, and in the nasal side this conical shape is there. Why? It is on because the cornea is cone shapen, and if you fell the light over here, then the shadow of the cone is in this part. So this is Rizzuti sign. Okay, now let's move to another sign, that is Vaught striae. So what is Vaught striae? So Vaught striae are fine vertical lines. Okay, so Vaught striae are the fine vertical lines in the deep stoma and decimate membrane. So you can see that there is vertical lines are there. So these are Vaught striae. Okay, these lines are parallel the axis of the cone, and it disappear transiently on gentle digital pressure. Okay, now another is that Fleischer ring. So what is Fleischer ring? So if you zoom this picture, then you can see a faint ring is there. This is best seen under slit lamp. Okay, so this is Fleischer ring. So the Fleischer ring is a yellow brown to olive green ring of pigment. Okay, you can see there is yellowish or brownish ring is there, as you can, if you able to see this picture. So this is yellow, brown, or olive green ring of pigment, which may or may not be completely surrounded the base of the cone. Okay, so this Fleischer ring denotes where is the base of the cone of the keratoconus. Okay, so here locating this ring initially may be made easier by using cobalt filter and carefully focusing on the superior of the corneal epithelium. So once located, the ring should be viewed in white light to assess its extent. Okay, then you will move to staining or a cobalt blue like this, but before that you need to see in white light. Okay, now acute hydrops. So acute hydrops, here is the thinning. Okay, if you do a optical section in this area, then you can observe this, there is a thinning in the central area. So acute hydrops is caused by break in the decimate membrane with stromal inhibition of aqueous through these breaks. Okay, so the edema may persist for weeks or months and usually diminish gradually with relief of pain and resolution of the redness, and corneal edema ultimately being replaced by scarring. So this ultimately leads to scarring. Okay, so this is acute hydrops. Now, so what are the management options that are available to treat these keratoconus condition? That the first is glasses. If the keratoconus is in initial stage, then glasses can also be prescribed as a management option. And as the keratoconus gradually increase, you can also prescribe the contact lenses. There is several options are there, like scleral contact lenses, rose K. This type of these types are available, so that you can prescribe it so to get the best corrected visual acuity to the patient. Okay, now another thing is that intracorneal ring also available. So what is intracorneal ring? So intracorneal rings are the segments of PMMA or silicons, and these are semicircles ring which are inserted to mid peripheral stroma, and which help to reduce the high refractive error and provides the better fitting of the cornea. So these intracorneal ring are placed, that I will show this all things in my later slide. So this intracorneal ring are placed to stop the weakening of the cornea. Okay, so here you can see that there is the scleral lens is fitted. So why scleral lens is selected in not RGP? Because the RGP contact lens have smaller diameter than cornea, so it will or it cannot cover the whole cone of the keratoconus properly. So scleral lenses are best option. So you can see in this picture that the scleral lenses are covering the conjunctiva also, and the cornea. So the cone is getting covered by the tear lens, so the person can get a good visual acuity by uh, putting the scleral lenses. Okay, another is that I showed or discussed, it's intracorneal ring. There is semicircle rings to stop the progression of the keratoconus. So these are also intracorneal ring. Okay, so there are several types of intracorneal rings, like Intex, Ferra rings, or Mayo rings. These are the several types of intracorneal ring. So another thing you can do is that I discussed in the in here is that penetrating keratoplasty, that is the corneal transplantation. So you can take the donor cornea and put the graft, or put the replace the cornea. So sometime there is failed grafting also there. So there should be a proper counseling before doing this procedure. And if there is a moderate and initial keratoconus is there, then the operation or surgery should not be an option, and the option should be a contact lens or intracorneal ring, or if possible then glasses also can work. If there is the glasses are not working, then contact lenses and intracorneal ring are also available. Now here deep anterior lamellar keratoplasty is also there, where the full cornea is not replaced, and there is decimate membranes remain, and above it is replaced. So these are the several management options. Okay, so so that's all, friends. Thanks for watching, and please don't forget to like my video, subscribe to my channel, and please don't forget to hit the bell icon so that you will get notification whenever I upload a new video. Okay, thank you so much.